Hello, my name is Dr. Lili Asma Ismail, and I am from UCSI University, Malaysia. And today I would like to share my presentation, which is titled The Therapeutic Effects of Anthocyanins on Vision, Eye Health, and Myopia Progression. And this is the topic of my presentation. And this is the agenda. And regarding the problem statement, during the last decade, the rapid growth of smartphone, computer, and visual display terminal used in the office and private place has led to an increase in ocular problems, including eye discomfort, blurred vision, eye strain, eye pain, and visual fatigue. And in response to an aging population in developed countries, rates of ocular disease associated with eye strain and external factors such as blue light and ultraviolet light have increased. Myopia or nearsightedness is a common vision condition in which near objects are seen clearly, but objects further away are blurred. And it is estimated that 1.4 billion people worldwide, or 22.9% of the world population, are myopic, and 163 million are categorized as having myopia. Malaysia shows a prevalence of myopia of 9.8% in children 7 years of age, which increases to 34.4% by the age of 15 years. And in the myopia progression in adult population, it was shown to be 85% in Asian countries and 33% in USA. Myopia, particularly high myopia, defined as spherical equivalent of greater or equal to negative 6 diopters for axial length of more than 26.5 millimeters, is associated with vision-threatening conditions. And some are irreversible, leading to pathological myopia. These include myopic macular degeneration, myopic choroidal neovascularization with heterogeneous retinal detachment, glaucoma, and cataract. It has been projected that 2.5 billion people, or one-third of the world's population, will have some degree of myopia by 2030, and 5 billion people will be myopic by 2050. And regarding anthocyanin, it is widely used as a supplement for eye health in Europe and East Asia. And EC has a relaxing effect on the ciliary muscle, which is important to treat both myopia and glaucoma. And the anthocyanin complex derived from bilberry and blackcurrant is widely utilized for therapeutic purposes in Europe and in Japan. The cyanine or AC complex from bilberry is widely used in Europe for medicine purposes and as a dietary supplement in countries, especially in Japan. And bilberry AC has been reported to enhance night visual acuity and is used as a supplement to improve vision health. The key mechanism behind the anthocyanin function in myopia progression control is ciliary muscle relaxation. And one theory for the cause of refractive myopia in childhood is that the ciliary muscle becomes spastic as hypercontraction during close-up work or near work, leading to spasmodic accommodation of the lens. And in the figure below, it shows the ciliary muscle contraction in response to accommodation, whereby the axial length elongation occurs. And the components of anthocyanins, the fruit known as the blackcurrant is well known, and 4 anthocyanins are present in foods with a high anthocyanin concentration, or BCAs. And these BCAs include 2 distinct cyclocyanidin 3 glucoside agglycones and 2 types of glycosides. C3G, cyanidin 3 glutinoside C3R, delphinidin 3 glucoside D3G, and delphinidin 3 glutinoside D3R. And the highest composition was found in the D3R, which is 47%, followed by C3R 35%, and the others is 18%, which is D3G 14% and C3G 4%. Regarding the bioavailability, a study was conducted using 13C labeled CpG to examine the human metabolism of PC. And in this study, the volunteers received 500 mg of 13C labeled C3G and 13C levels in the blood, urine, feces, and breath was measured for the next 48 hours. And the calculated bioavailability was 12.38% with a standard deviation of 1.38. And Matsumoto found that the BCA passes intact through the blood-brain barrier and blood-retinal barrier in both rabbits and rats after intravenous and intraperitoneal administration. In addition, the total concentration of AC in several ocular tissues was higher than that measured in the plasma, suggesting that AC can concentrate in ocular tissues. Significantly high AC concentrations were found in some ocular tissues when the BCA was administered either intravenously or intraperitoneally. And delphinidin-3 retinocyte or D3R is a main component of anthocyanins present in blackcurrant will generate a prolonged increasing relaxation in response to endothelin ET1-induced contraction. D3R has an inhibitory effect against the CM contraction. The contraction of the ciliary muscle is caused by several receptors, whereas the relaxation of CM is only either one of the two mechanisms. The beta, adrenergic, and prostaglandin receptor responses are involved in one pathway of the cyclic adenosine phosphate or CAMP dependent system, whereas the nitric oxide or the NO is involved in the other pathway, which is the relaxation. And the ciliary muscle or the CM controls the lens focus, production of aqueous humor, and participates in maintaining ocular pressure. CM has been the focus of multiple studies as a potential target for anti-glaucoma, myopia, and visual fatigue therapies. And to define the AC recovery in transient refractive change, the effect of AC on endothelin ET1-induced contraction of CM to determine whether smooth muscle relaxation pathways are affected by the AC. And the value for relative tension with D3R and C3R treatment had a significant difference with the control that occurred without the addition of any compound. Treatment with BCA of 50 mg also had a significant relaxation activity. For the Q3R and M3R, which had a similar structure to the C3R and D3R, there was no relaxation activity within a 60-minute treatment. The CM contraction is mediated by several receptors, whereas the relaxation is administered by two mechanisms. One CAMP-dependent pathway includes the beta, adrenergic, and prostaglandin receptor participated responses, and the other CAMP-independent that involves an NO involving relaxation. The D3R pretreatment had a preventive effect against ET1 contraction in CM, and shown in 3 with a simultaneous increase in cGMP production and a decrease with NLC phosphorylation. However, in the presence of NOARG as the NOS, the carboxy PTIO as the NO scavenger, and OD2 as the inhibitor of guanylyl cyclase or BQ788 as the ETB receptor antagonist, D3R has no effect against ET1-induced contraction. And in vascular endothelial cells, ETB receptors activation by ET and resulting NO release have been suggested to promote the vascular relaxation and to decrease the arterial blood pressure. And in table 3 shows the comparison of contraction of the ciliary muscle by one. For the control, the contraction is 54.9% compared to the D3R, which is 42.2%, and it shows a decrease in the contraction with the D3R treatment. And studies has been done on the myopia experimental model in chicks, which is initiated by fitting a negative lens. It manifests a axial length elongation in corresponds with the hyperopic focusing and is an animal model for human myopia, particularly which develops during school age years. The increase in axial and ocular length caused by wearing a negative lens was significantly inhibited by orally administered BCA. The higher dose of BCA or 100 mg significantly inhibited axial length elongation compared to the distilled water control. As you can see, it's 0.22 with a standard deviation of 0.033 millimeters versus 0.41 standard deviation of 0.042 mm. And a lower BCA of 50 mg was also associated with a reduction in the axial length elongation, which gives a 0.32 standard deviation of 0.032. However, the ocular length of the birds fed the dosage of BCA was significantly shorter than that of the control birds. And in the hyperopic focus, peripheral hyperopic blur, the peripheral image shall form in the eye of a well-corrected or undercorrected myope through the use of best form lenses is hyperopic in nature and therefore found behind the retina. And as the peripheral retina photosensitive and processing cells have evolved to seek images with the best age gradients and highest contrast, mechanisms in the eye have been created that automatically try to extend the peripheral retina backward in order to obtain optimal contrast in the image plane. And the end result is an axial elongation of the rare scleral shell, resulting in increasing the myopia. As you can see in the figure shown, the hyperopic refocus, whereby the light rays is focused behind the retina, and this will increase the myopic refractive error due to the hyperopic refocus, which is a stimulus for further increase in axial length. And studies has been done on pseudomyopia, whereby accommodative alterations or pseudomyopia following a long-term near visual task, and it is considered as the physiological parameter of eye fatigue. And the effects of BCA on transient refractive changes and asynopia were tested in 21 healthy subjects. Double masked, randomized, crossover design, subjects divided into BCA or placebo groups, and each subject was tested at 1 week intervals between the BCA intake. The subjects were given 200 milliliters of juice containing EC, which is 50 mg, or a placebo, and the subjects ate food 2 hours before the visual task, and visual fatigue was compared before and after intake. The simple computer calculation task was performed for 2 hours without any rest, and after completing a task, the refraction values, flicker test, and visual analog scale were measured. The spherical and cylindrical refraction value of the eye was first measured using an autorefractometer, and the refraction value was evaluated regarding the spherical equivalent of sphere plus half of the cylinder. And the flicker value was next determined using the critical flicker fusion or CFF. And the results are summarized in Table 6, whereby in the placebo trial, the refraction values after visual task showed a remarkable decrease that had borderline statistical significance. In comparison of refraction values before and after BCA showed that the mean values were similar. In contrast, the mean changes of BCA and placebo were negative 0.30, standard deviation of 0.252 diopters, and 0.119, standard deviation of 0.278 diopters respectively. And this difference was statistically significant. However, the flicker values did not show differences between BCA and placebo groups, whereby the mean values for the 5 criteria used as a subjective assessment of astigmatia were higher in every group after the task, but the increase was smaller for the BCA group. And there were significant differences in value for the BCA and placebo for astigmatia symptoms at two sites, which is the eye and the lower back. And in clinical studies of the EC effects in glaucoma patients, it was found as the D3R potentially activates the ETB receptors to promote the NO release, the EC may alter the ET1 receptor mediated ET1 metabolism to impact the hemodynamics of retinal blood circulation and alter the blood flow at optic nerve gates. And in a clinical study, 30 consecutive blood flow at the neuroretinal rim of the optic nerve gate and peripapillary retina was evaluated using a scanning laser Doppler flow meter before and after 6 months of administration. And the IOP for every patient almost remained stable in the BCA group during the test period. However, ET1 concentration in plasma had significantly increased from 3.27 standard deviation of 1.67 to 4.10 standard deviation of 2.14. Before and just after the administration period with a p-value of significantly 0.05. And after administration, the blood flow of the superior and inferior temporal neuroretinal frame of the optic nerve gate and peripapillary retina in both eyes were significantly altered. As you can see in table 7, the retinal blood flow of the superior retinal frame and inferior temporal retina after consumption of anthocyanins for 6 months in the left eye showed that after 6 months, it's higher compared to the before treatment. And a prospective case control study conducted by Omar in 2018 on slowing myopia. He included children with the age range of 6 to 14 years of myopia of more than 6 diopters, normal and anterior and posterior segments. And the patients who participate in the study were subjected to full eye examination, anterior segment examination with slit lamp, posterior segment examination using indirect ophthalmoscope, and slit lamp with high class lenses, ocular motility, cycloplegia with cyclopentolate, measurement of refractive error after 1 hour using an autorefractometer and XIR lamp measurement with the scan. The children were randomly divided into 2 groups. Group 1 is the deferral, comprising of 32 myopic children, administered the deferral E 50 mg tablets for 20 days every month for 1 year, stopping afterward. And deferral E is composed of anthocyanins of bilberry and vitamin D. And group 2, which is the controls, had 32 myopic children who did not take any deferral. The cycloplegic refraction was done, XIR length was also measured in participating children every 6 months for 2 years, and for children in group 1, 1 year while they were on deferral, and another year after stopping it. In the high myopia, oral deferral reduced the XIR elongation and halted the myopia progression, as shown in table 1 and table 2. Other studies has also been conducted. A study conducted by Kamiya, who studied the effect of fermented bilberry extracts on the visual outcomes in myopic eyes. And with an increase in subjective accommodation and mesopic contrast, the drug's effect on refraction or XIR length was not studied. However, the effect of oral deferral on myopic children with a 6-month follow-up, it was found that myopia progression was controlled in those with mild and high myopia, and no effect was found under moderate myopia. In a study by Deng, he found that study done on guinea pigs demonstrated that orally administered infrared inhibited axillary elongation in form deprivation myopia and might be useful for preventing myopia progression in clinical practice. And a study conducted in Singapore on the different concentrations of atropine on myopia progression. It was called the ATOM study. Although they were satisfied with the myopia progression control, there were a lot of side effects, such as hypersensitivity, reactions in skin and conjunctiva, impaired near work in some children caused by the pupil dilatation and rebound progression in myopia after atropine treatment stopped. And some researchers have studied the effects of contact lenses on myopia progression, which is the multifocal contact lenses. However, complications such as microkeratitis have been documented. Another method is the autokeratology, which have been proven effective in controlling myopia and slowing the progression. However, there's a lot of complications reported, such as microkeratitis, conjunctivitis, and peripheral ulcer. The conclusion is that the therapeutic application of AC has shown potential for improving eye health, and AC has specific effects on rhodopsin regeneration and smooth muscle relaxation in vitro. In studies in vivo, AC was present in eye tissues and improved blood circulation. These findings were also reflected in clinical trials of BCA to improve vision health. Together, these studies suggest that BCA could be an effective nutraceutical product for the treatment and prevention of an optical disorder. These are my references. Thank you for listening.